All right, let's jump right in. Today we're going to unpack a medical puzzle that sounds simple but is actually, well, really tricky. How do you measure a disease when any single moment could be a catastrophe? We're diving into hereditary angioedema, or HAE, to figure out why just slapping a label on it is so incredibly difficult.
I mean, think about it for a second. With most conditions, doctors use words we all get, right? Mild, moderate, severe. It helps everyone understand what's going on, what to expect. But what happens when that entire framework just breaks? And boom. This right here, this is the absolute heart of the problem with HAE. This one fact changes everything. It means that a patient who gets, say, an infrequent minor swelling on their arm is technically facing the same potential risk of a fatal throat swelling as someone who has attacks every single week. It creates this huge paradox. So, yeah, that constant underlying risk is what makes creating a simple severity scale a total puzzle. It's the central challenge that doctors and researchers have been wrestling with for years.
Exactly. How can you possibly label a condition mild when that worst-case scenario is always on the table? This is precisely why, for a long time, the medical community has struggled to agree on one single classification system for HAE. The old labels just don't fit the reality of living with this disease.
But of course, that didn't stop people from trying to crack this nut. In the early days of really getting a handle on HAE, researchers made a serious effort to put some numbers to it. Let's take a look at one of the first major attempts. So you have to go back to 2011. A researcher named Bygum and her colleagues came up with the 0 to 10 scale. And at the time, this was a pioneering move. It was a real attempt to get away from just subjective feelings and put a concrete number on how much HAE was affecting a person's life.
And what's really interesting is what they chose to measure. It wasn't just about, how many attacks did you have? They looked deeper. They asked, how early in life did this start? How widespread were the attacks across the body? And did the person need constant long-term medication to prevent attacks? It was a much more holistic view.
But here's the thing. While it was a brilliant first step, the Bygum score never really took off. It wasn't formally validated for widespread use, and I think the medical community started to realize that maybe they were trying to answer the wrong question.
And that realization, it led to a massive breakthrough, a real aha moment for the field. The goal wasn't to find a better label. The goal was to change the entire way they thought about measuring the disease.
Okay, this slide just nails that shift in thinking. On one side, you've got overall disease severity. Think of that like trying to define the climate where you live. It's the big picture, long-term reality. But on the other side, you have disease activity and control. And that is the weekly weather forecast. It's dynamic, it fluctuates, and it's what you actually need to manage day to day. This was a game changer. So this new perspective led to a whole new set of tools, a modern toolkit designed not to just label a patient, but to really understand and manage the weather of their HAE.
So first up, you have tools designed to measure one single event. When an attack is actually happening, these instruments give doctors and patients a way to quantify it, to put a number on it. It's like taking a really clear snapshot of a specific moment in time. Two of the main ones you'll hear about are the MSCS and the TOS. They measure things like how bad the swelling is in different places and how a patient's symptoms respond to treatment. But, and this is a big but, they're pretty complex, so you'll mostly see them being used in clinical trials for new drugs, not so much in a regular checkup.
Now, this is where things get really practical for everyday management. These tools are all about tracking that weather forecast, the disease activity, over a period of weeks or even months. And there are basically two main ways to go about this. The Angioedema Activity Score, or HAE-AS, that's a daily diary. It's prospective, meaning you're tracking symptoms as they happen. On the flip side, the HAE-AS is retrospective. It's a questionnaire that asks you to look back over the last 6 months. Different approaches, but both are validated ways to really get a handle on the disease's rhythm. Okay, so if you follow HAR research pretty closely, you might have seen a new score pop up in 2025 called HADES. It's super important we clarify what this is and, more importantly, what it isn't.
The HAE-AS system gives a score somewhere between 0 and 18.5, and it uses clinical science to predict something very, very specific.
And here is the key point. HAE-AS is a tool for diagnosis. It's designed to help doctors figure out the likelihood of HAE before a blood test confirms it. It is not a measure of how severe the disease is. It's a completely different tool for a completely different job.
So, after this whole journey, this entire evolution in thinking, what does it all look like in the clinic today? How do doctors actually put all these pieces together for their patients?
Well, it boils down to this really comprehensive four-part check-in. They look at the attacks themselves, how severe, how frequent. They measure that recent weather, the current disease activity. They ask about the impact on a person's quality of life, which is crucial. And finally, they assess how well the current treatment plan is actually working to control the disease. It's about seeing the whole picture.
Ultimately, the story of measuring HAE is a story of moving away from one single static label like severe and moving toward creating a dynamic, complete picture of a patient's experience. The goal is understanding, not just categorizing. And that leaves us with a pretty fascinating thought, doesn't it? What we've seen happen with HAE, this shift from simple labels to continuous, dynamic data, could that be a preview of where medicine is heading as a whole? It really makes you wonder what other conditions could benefit from this more nuanced approach. Thanks for joining us.